that's a tremendous exaggeration. Nicotine does cause constriction or reduction in the diameter of blood vessels, but that's a physiologic response. That is not a disease or pathology. In fact, many athletes use smoke-free forms of nicotine. Swedish athletes, Swedish soccer players and hockey players use snus, which contains lots of nicotine. So the idea that it is nicotine driving the cardiovascular diseases is absolutely false. Well, oral contraceptives do have some risks in some situations. I'm not an expert with contraceptives, but once again, that nicotine that's an exaggeration of nicotine's effects on a healthy person. Well, I happen to know a little bit about insulin and diabetes. I conducted a study with Swedish colleagues looking at whether or not smokeless tobacco, smoke-free tobacco, is related to diabetes. And we found no evidence that it played a role in diabetes. Now, we do know that smoking plays a role with diabetes. There's no question about that. And this is the problem with all of the things you're asking, is sorting out the effect of nicotine from the effect of smoke, which contains 7,000 other chemicals. That's the problem when we exaggerate and blame nicotine for all of these effects that you're reading. I know exactly what Buerger's disease is, and it is a very rare phenomenon where people do react to nicotine, but it is exquisitely rare. It is a true disease, there's no question about that, but extremely rare. And to bring that up for a population is ridiculous, because it is a special set of circumstances that doesn't apply to almost anyone.
Yeah, you cannot say that it doesn't exist, but to highlight it, it's a
exactly
overreaction.
Absolutely, absolutely. I acknowledge it, but to say it's a common effect, this is simply a list of scare tactics that people use to demonize an otherwise This is a scheme that people use to demonize nicotine when it is really no more risky than caffeine. That's something I have been talking about and lecturing about for at least 28 years. That nicotine and caffeine are very, very similar in their effects on the body and in the way people enjoy them. And so to demonize nicotine is impossible. Well, once again, nicotine does constrict the blood vessels. That's all it's saying, is nicotine constricts or reduces blood flow. But this is a physiologic effect. It's only while you're using nicotine, okay? So nicotine, because it reduces the blood flow a little bit, It also increases blood pressure while you're using it. We call it a transient effect. Smokers are not at risk for hypertension, what we call serious hypertension, but they do have a mild elevation in blood pressure when they smoke or when they use nicotine. Just like my blood pressure probably goes up when I drink a cup of coffee, only for a short time, okay? It also increases my heart rate transiently, only while I'm using it, only while tobacco users are using nicotine.
Which doesn't mean that's a long-term issue, right?
No, not at all. In fact, when I exercise, my heart rate and blood pressure go up a little bit. There are lots of things that we consume and do as humans that create physiologic effects. Otherwise, we would be super people. So these are only effects that someone is exaggerating because they want to demonize the drug. Well, once again, this is an effect that is possible over a large population, but to my knowledge, I don't know of any specific effect that smokers have been unable to have children. I don't know any population effects. We also know that nicotine can have some modest effects on developing babies in pregnant women. So yes, it has effects. So does everything else we consume. But to say that that's the reason that everyone must be abstinent is absurd. I'm not aware of that effect separately from smoking. Once again, smoking causes so many effects because it has so many thousands of chemicals. I'm not aware that that's a specific nicotine effect. I've never heard that issue with respect to smokeless tobacco or other forms of non-toxic, non-combustible tobacco consumption. No, I reject that. There is absolutely no evidence whatsoever that nicotine causes cancer. Now, if you take some laboratory cells grown in the laboratory, and you flood them with nicotine, you can punish those cells, you can mistreat those cells, and you can make them do anything you want. You can abuse them by flooding them with all kinds of things, and you can then say inappropriately that your nicotine is causing some effect at the cellular level. But from a standpoint of the human level, we humans are not just a mere composure of cells. We're fully functioning human beings. And to say that in that context is wrong. Number one, all of the studies about that finding were done in laboratory mice or laboratory cells. There are no findings whatsoever in humans. And let me give you a good example of that. in the United States right now, we have approximately 30 million current smokers and perhaps as many as 60 or 70 million former smokers. No one has ever demonstrated that they have a brain defect or that they have a lower cognition or any other defect related to having either currently or formerly smoked. If you're going to make that claim about adolescent brain development, then you must demonstrate it in adults who have smoked for their career. You know, if you were going to say that, by God, you have to be able to say it with current or former smokers, right? They have to show brain issues. And then that's never been, you know, they ought to make that charge to current and former smokers and watch them react.
Yeah, just a form to spread misinformation. No?
Exactly. It's a way to spread misinformation. Well, you know, the misinformation about nicotine is so pervasive, it's so systemic, that it's very difficult to break out of the misinformation. And I can give you an example. I started conducting serious research on this topic in 1994. Believe it or not, before 1994, I had the same misinformation as everybody else. We are taught misinformed, and we continue to teach our students about the misinformation unless the cycle is broken. And so the cycle is so systemic right now and so embedded in our culture and our societies that it's a very, very difficult struggle. Once that misinformation is embedded, it's very difficult to remove it. And so now, I think it's interesting because I've lectured extensively in the United States. And when I get practicing physicians, practicing health professionals, they're in the trenches. They're seeing all the diseases, all of the issues, all of the deaths, okay? When you present this idea to them, they're pretty good. They need another option to help their patients quit. They need other tools to help them help their patients. But when you go from practicing toward the society level with large organizations and government agencies, then the resistance becomes massive because they have policies that they're unwilling to change. I think these agencies, their whole existence depends on there being a crisis. And they see what everybody else sees. The crisis from cigarette smoking is gradually declining. We can see in the distant future that cigarettes are not going to be very popular. We see this here for sure, and we see it in other countries too. You know, one of the things, I've traveled a little bit in Latin America and Latin America, and your rates of smoking there are generally much lower than in the US, Canada, even the UK, and some parts of Europe. You don't have horrible smoking rates. But that doesn't mean that the anti-tobacco extremists can't use the whatever smokers you have as tools for bringing more control over people's lives and not giving them access to safer alternatives. I was drawn into this field as an oral pathologist. So my job was under the microscope, in clinics, and in a very major cancer center and hospital. I saw hundreds of patients who were at the end of their life. They had been diagnosed with lung cancer, other cancers in the head and neck, we would say, other diseases, many, many, many diseases. And so I was compelled to, when I thought I had an idea for a way for those smokers to quit burning tobacco and inhaling 7,000 chemicals before it was too late, they might switch to a far safer product. That was my idea, and I found support for that idea in research by Michael Russell and others. My first paper had 2 citations to his work, and a later paper I did had 4 citations to his work. Never, ever would I have imagined to have received or even been on the same page or in the same book or in the same universe as the visionary who is the grandfather of tobacco harm reduction. Now, I said I was a pathologist. The tobacco control field, the professionals, are generally addiction, psychiatry, psychology, public health. They're generally people from those fields, and that's not my field. So I was never part of the typical tobacco control community. I was kind of by myself. But this award it sends the message to me that my work has been meaningful for more people than I had ever imagined. And that's what makes it so very special. And I know it's also special to the people who are affected by the products, the vaping community, the smokeless tobacco users. That's who I've constantly been striving to reach with, and why I'm willing to do these kinds of interviews. Shortly after I started in 1994, I wrote a book for smokers only. It was the only way to reach people way back then, when we didn't have an internet. But now we have many more tools, and this is one of them. It's a great way to reach out. So that's why it's really meaningful and why I'm very humbled to have had this opportunity.